You are welcome to this presentation of Breaking Sad News or Bad News, the Masterclass Psychiatry Medicine. I'm Dr. Prosper Tettey Doe, practicing medicine, psychiatry in the United Kingdom. The first is to set the clinical scenario for such a case. Mr. Sam is here to see you. His father was admitted 2 weeks ago after his detention under Section 136 of the Mental Health Act. He was found by the police wandering and was not able to give any personal information. Since admission, he has undergone few investigations, including a CT brain, and Mr. Sam is here to find out about the results. So it's clear from this that all the routine investigations were normal. CT brain revealed, however, multiple lesions suggestive of metastatic cancer. This stage requires the candidates to demonstrate empathy and sensitivity in breaking bad news to a concerned relative in a simple language. So first, introduce yourself and explain the purpose of the interview. Explore what the son knows already and acknowledge concerns. Quickly recap the circumstances, that's the summary of the admission circumstances surrounding admission. For example, as you know, your father was admitted in a rather confused state. Since his admission, we have done various investigations to find the cause of his confusion. One of those investigations was CT scan of his brain. You might have known already, CT scan is a special scan which gives detailed pictures of the brain. Unfortunately, this scan showed some abnormalities in your father's brain. I'm sorry to say that it is a strong possibility that your father has cancer that has spread to his brain. Here, any silence or anger in the station is a normal shock reaction. Allowing this silence or ventilation of anger might be a good technique in this station, and do not prematurely reassure the relative. Ever so often, give time for the relative to take in information and check whether you can continue. The next is to inform only. Inform that it is your suspicion that it cannot be cured. The cancer has spread. Inform also that you are looking for management to keep him comfortable and prolong his life. Inform that you will make an urgent referral to the cancer specialist, and you will be working closely with them to help his father in this situation to the best of your ability. Inform also that till you will discuss his case with the oncologist, your plan is to keep him in hospital. He might have to move to a general hospital. You are not the specialist in the area, and so you cannot give clear information on available treatment and how long the patient will live. This is very important, so you don't make guesses. You leave it for the oncologist. You will also keep the son informed and definitely include them in deciding a management plan. At some stage, a carer's assessment will be arranged in order to make sure that the son gets enough support as a carer. Also, management would include medication to improve his quality of life, counseling and support to the family, and organizing support and help through various organizations such as the following cancer support and care organizations: Cancer Black Care, which provides information, advice, and support services for cancer patients and their families, which is sensitive to cultural and ethnic diversity. On this may be feasible. Macmillan Cancer Relief is a UK-wide charity which provides a free confidential support service and works with support groups to help people with cancer, their families and carers to find emotional and practical help close to home. The Brain Tumor Action also provides information on local support groups. Some of these are groups for people with brain tumor, others are for their family or carer, and others are joint groups for patients and carers. Then finally, but not the least, is the Marie Curie nurses. They provide free nursing care to cancer patients and those with other terminal illnesses in their own homes. Thank you very much for your attention, and this brings us to the end of this presentation. And I wish you all the best in your career. And if you like this presentation, click on the subscription button and you receive future presentations of topics relevant to psychiatry and medicine professionals. Bye.